Hello and welcome to GastroVision. I'm Dr. Qazi Suhail from Government Medical College, Srinagar. Today we are focusing on a very important and often misunderstood part of liver anatomy, the caudate lobe. Although it's the smallest anatomical lobe of the liver, the caudate lobe has unique boundaries, vascular relationships and drainage patterns. Its correct identification on endoscopic ultrasound is crucial for localizing lesions, staging hepatocellular carcinoma, and planning hepatic resections. Anatomically, the caudate lobe corresponds to the segment 1 of Coinard's classification. What makes it unique? It has independent venous drainage directly into the inferior vena cava. It has dual portal inflow from both the right and left portal branches, and it is located in the strategic central position, bordered by major vascular structures. The inferior vena cava lies posteriorly, the ligamentum venosum lies anteriorly, and the porta hepatis inferiorly. Let's explore its boundaries and relationships step by step. In this image, we see the apex of the caudate lobe. It is shaped like a wedge and lies near the confluence of hepatic veins. The key points that are important here: the base of this wedge faces the inferior vena cava. The apex points towards the diaphragm, and this superior portion is often seen between the hepatic veins as they enter the inferior vena cava. Segment 7 of the right lobe lies adjacent inferiorly. This view is essential for orientation, especially when assessing lesions near the hepatic vein confluence or subdiaphragmatic liver. The next image illustrates a clinically significant scenario: a space-occupying lesion that's located near the tip of caudate lobe. The important anatomical details that are present here: the lesion lies between the endoscopic ultrasound probe and the inferior vena cava, highlighting the posterior boundary of the caudate lobe. The anterior margin is demarcated by the fissure of the ligamentum venosum. This is a classic appearance for caudate lobe metastasis or hepatocellular carcinoma. Because of its proximity to the inferior vena cava and hepatic veins, lesions here require careful preoperative mapping and often specialized interventional approaches. Moving on to the next image. In this image, we focus on the caudate process, an important anatomic bridge connecting the caudate lobe to the right lobe of the liver. Here is what you should note. The caudate process runs between the inferior vena cava and portal vein. It represents the medial boundary of the caudate lobe. Blood supply to the caudate process often comes from both right and left portal branches, and it drains directly into the inferior vena cava. Understanding this continuity is crucial. It explains why some caudate lobe tumors can extend into the right lobe, or why resection sometimes involves the caudate process separately. Finally, this image shows the anterior aspect of the caudate lobe. The key landmarks here are the ligamentum venosum. It runs towards the umbilical part of the left portal vein. This structure divides the caudate lobe from the left medial segment, that is segment 4. The anterior border of the caudate lobe is defined by the attachment of the ligamentum venosum. This marks the lowest point of the anterior edge. Also visible are the left hepatic vein and the inferior vena cava, which complete the triangular boundary of the caudate lobe from the anterior and posterior aspects. Let's summarize the key features of the caudate lobe anatomy. First is apex. In the first image, I have shown a wedge-shaped structure near the confluence of hepatic veins. Second is the posterior boundary. Posterior boundary faces the inferior vena cava. It is a common site for lesions like metastasis or hepatocellular carcinoma. Caudate lobe connects the caudate lobe to the right lobe, receiving dual portal supply. Anterior boundary is marked by ligamentum venosum, separating it from the left medial segment. And most importantly, segment 1, that's caudate lobe, drains directly into the inferior vena cava. often through multiple small hepatic veins, a fact that has major surgical implications. Thank you for watching this advanced tutorial on EUS imaging of the caudate lobe, its boundaries and relationships. Understanding the anatomy of the caudate lobe is essential not just for anatomical mapping but also for accurate tumor localization, interventional planning, and surgical resections. Thank you and see you in the next video.